Peninsula Healthcare District? Hey guys, I bet you think it's all about Peninsula Hospital. Surprise! Most of us who live in the Mid-Peninsula area have heard of the Peninsula Healthcare District, but don't completely understand the wide variety of programs and benefits we get from this local resource. In this short interview, we'll learn about the new wellness center, the Trousdale Assisted Living Facility, Sonrisas Dental Health, and how the district keeps growing to meet the needs of more than 200,000 residents of San Bruno, Millbrae, Burlingame, Hillsborough, San Mateo, and Foster City. Our guest is CEO Cheryl Fama. Welcome, Cheryl.
Thank you.
Happy to have you here today.
Glad to be here.
So tell us about the facilities the district manages. You just opened the Trousdale and Burlingame, which I mentioned. Can you elaborate a little bit on that?
I'd love to. We've been around 70 years. We had a hospital for a long time. Now the Sutter runs the hospital, so we have turned to our community. If you don't mind, I'm going to start with what is the vision of the district. We really exist. We exist. And we have as our vision that all of our residents, all 200,000, have an opportunity to achieve their optimal health through prevention, education, and access to basic services. So let me tell you about the 3 recent programs, because what we run, we've recently opened the Trousdale that you just referenced. It's at 1600 Trousdale, right across from the Sutter Health Hospital.
Oh, okay.
We opened up, what I would say, that's a good example of good stewardship. We have an acre that we manage on behalf of our taxpayers. And we use that for 124 unit assisted living and memory care facility. We opened just on December 26th of this last year, and we're proud to say we have 70 residents that are enjoying the facility. Our Trousdale Wellness Center is just up the street. It's not related in that it's not limited to the assisted living residents. It's open to all residents in and outside of the district. It's open to anybody over 18. It's a gym facility that has a lovely amenity to be a socializing where seniors can connect with one another and enjoy their company, as well as an area for health education and wellness programs. And a sample of some of the classes that we offer there, again, open to everybody, are Tai Chi, yoga, mindfulness nutrition, stress management, balance and fall prevention, and programs that we think are good for keeping people healthy and at home. Sonrisas Dental Health is a much bigger project for us because the other 2 facilities I mentioned, the district owns the land on behalf of the taxpayers, and we're putting it to use in what we think is the best use for our residents. Sonrisas Dental Health was a bigger venture for us. It's located at 430 North El Camino, which is just where El Camino and Poplar cross. Everybody knows where the Arco station is. It's just past the Arco.
In Millbrae?
In San Mateo.
Oh, in San Mateo.
In San Mateo.
Okay.
And we purchased that building and we recruited this program to operate out of it. Sonrisas Dental Health is very unique. It is a nonprofit clinic that is open to everybody. 1-year-old, 101-year-olds, insured, uninsured, Deni-Cal. It's one of the most needed services and one of the most difficult to access. If you're over 65, Medicare doesn't cover it. If you're Deni-Cal, nobody takes Deni-Cal.
Right.
We treat everybody. We're very proud of the facility. It has special equipment in it. It has lifts that can take people from wheelchairs into the dental chair. It has IV sedation capability for autistic children, for folks with dementia where they get very agitated if they need dental care. So it really is geared toward meeting all the needs. I am so proud of that facility, and I will just talk in the last year and a half alone. It both is San Mateo Center, and it also has an affiliate in Half Moon Bay. But in the last 18 months, we provided over 16,000 dental visits, of which 69% were uninsured, low-income, sliding scale cash pay, and Deni-Cal. So all programs, I think, exemplify our efforts to address our residents' needs and to put our resources to good use to fill gaps in care.
That's wonderful. How new is the dental facility?
It opened in 2015.
Oh, okay.
It actually opened in 2015 by a different operator that we recruited outside of Minnesota, but not to get into too much detail. This isn't Minnesota, and you can't run a franchise using Minnesota ways. It's just different laws and regulations. But it's not just a dental center. We also have mobile capability. We also do significant amount of outreach. So I gave you 16,000 visits in the centers. We also have done hundreds of screening in schools from the coast side, San Bruno, and southern part of the county. And we also do on-site, we have a contract with the county, and we actually bring actual dental operatory equipment to Pescadero in a meeting room. We bring direct care services to farm workers and their families. So it allows us to go well beyond just the formal cities that we cover and to really meet the needs of the most vulnerable in our communities.
That's really important because I think a lot of people don't get health care because they can't. They're not mobile enough, or they're unavailable, or they don't drive, or so
that's the mission statement of Sonrisas, is to remove barriers to care.
That's very important.
The fear of, I haven't seen a dentist for 10 years, I don't know where to start, to I can't get mom with dementia to even to the dentist, let alone get her in the chair, to I can't afford it. And we try to remove those barriers.
How would one go about utilizing the services that the district offers?
Well, each one has a website. You can call us at our main number at the district, or certainly they all directly, you can reach the Trousdale Assisted Living welcomes drop-in if somebody wants to come in and just tour the facility or make a call. The dental center as well, you can give a call to see if you can get scheduled an appointment. And the wellness center is the same way. You can call in, website in, internet in, or come on by and check it out.
And the wellness center is membership based, I believe?
Oh, it is membership based, but we want to make sure we expose to everybody. So there's an opportunity to come in for a one day test.
See if you like it.
Maybe a brief three-day stay just to see what the equipment. How the equipment works for you and the convenience. Our hours are 6 a.m. to 8 p.m. Monday through Friday, and we have at the Wellness Center, and we have Saturday hours 8 to 12.
That's great. I think the Wellness Center, most importantly, focuses too on education, preventative maintenance, which I think is important, especially as we age, you know?
Well, one of the things I like to say about my whole healthcare career, because 3/4 of it was in acute care hospitals, and the last 12 years I've invested in my role at the district, and I love it.
And you're also a nurse.
I am a nurse.
Right.
I am a nurse, started as a critical care nurse and worked in acute care hospitals, but I always thought I was in healthcare. That's what they taught you in nursing school, but I was always in sick care. You had to be pretty sick to come into my building. Now my whole focus is how do you get services to the community? The best way to treat illness is to prevent it in the first place. And there's so many things that can be prevented, and we aren't as literate as a society on how to use healthcare. I don't want to get on
I think you're correct, yes.
Don't want to get on a
Yes.
Colon Cancer Screening Month. Colon cancer is it's preventable. Nobody wants a colonoscopy.
Right.
Diabetes is very preventable. So many people have the onset because of weight, because of lack of exercise, because of eating. There's so many things we can do. Another area we're really focusing on, just to switch a little bit, because we look at all ages and all of the needs of our population, we've been focusing a lot on youth and teen behavioral health issues.
I was going to touch on that. I'm really curious to hear about that.
Yes, we've enjoyed working very closely with the K-8 school districts within ours, as well as the San Mateo Union High School District. And with the local school districts, we've done a 3-year Healthy Schools initiative where we really help provide PE instructors and nurses and counselors to see where the needs were. Well, clearly counseling and behavioral health rose to the top. So the next special funding initiative that we've done in partnership with the San Mateo Union High School was how can we coordinate and better organize all of behavioral health services for all of the kids in our high schools, which are 8,500 are covered by district high schools. Wow. And now more recently we've taken it a step further, and we're working with the Stanford Gardner Research Center and with the cooperation of the K-8 schools. We're looking back in student records, graduate students and current seniors, to see if there are any behavioral issues or attendance issues or signs that we could pick up earlier where we could build into the curriculum or support services actionable steps we could take to help the kids transition from 5th grade to 6th grade or middle school. to help them transition from middle school to high school. And we think that that can go a long way in helping get them more focused and centered so that they can have a better chance to learn.
So you really do work with all parts of the community?
Absolutely. We're part of the fabric, or the healthcare fabric of the community. We have a wonderful community health partner, and there are so many very capable nonprofit organizations that we partner with. We build buildings and we run them. We do special initiative funding, but a big part of our program is our partnership with our community agencies and our annual community grants program. Just the last 2 years, we've funded over 50 community-based organizations that serve all ages, everything from healthy kids, newborns, to the seniors. And we gave $3 million out in grants, support grants. So yes, we do work with the community.
And who manages the district?
Well, we have 5 elected officials. They're elected at large, and I report to them.
Okay.
But ultimately, we're all accountable to our residents. We're a local government, local agency that uses local taxpayer dollars with the single purpose of supporting the needs in this local community.
So you really are, you're doing everything to help the local community. That's the fundamentals of it.
Our whole reason to exist is to make sure we address the health needs of our broader community.
So overall, from our discussion, what are you, as the CEO, most proud of?
I'm extremely proud of the fact that I think we do make a difference, that we have made a difference for 70 years, that we're not stuck in this is the way you need to do it. We've evolved over that 70 years just as technology and healthcare has evolved. As I mentioned earlier, that I'm not in sick care anymore. It truly is healthcare. And that I work for 5 individuals who are public officials who take no benefits, take no meeting stipend.
Wow.
They live here and they are professionals who give 80 to 100 hours a month exclusively to make sure that we know the needs and we address the needs, and we follow up to see if we hit the target or not, and are willing to change to make sure we can continue to make a difference.
So they're not just talking the talk, they are walking. You guys are all walking the walk.
I believe we are, and we'd love to have people come to our meetings. Every meeting we have, we're a public agency, and everybody is welcome to come. Our meetings are sometimes at Millbrae City Hall, sometimes at Burlingame City Hall.
Very good to know. Well, I think that about sums it up about the Peninsula Healthcare District. Thank you so much, Cheryl,
Thank you,
for being
Lisa.
here with us today. Thank you for all the good that you are doing for everybody. And you can check out the Peninsula Healthcare District on their website, which is located on the screen. Thank you for taking notice of our show. I'm Lisa Charney. Have a safe day.